Hi, welcome to the Healthcare Information Session. We hope you find this recording helpful as you determine how to move forward in obtaining a career in healthcare. We'll go over financial assistant options, registration information, what to expect in each of the programs, and a snapshot of the job outlook for each profession. We offer several healthcare programs to get you started in a career in healthcare: dental assisting, medical assisting, patient service representative, pharmacy technician, and phlebotomy. We'll go over each of these programs in future slides. One of the top concerns is, how am I going to pay for this? So fortunately, there are several financial assistance options for approved courses. There is a state grant called Fast Forward that will offset the cost of the class by 2/3 the cost of the class. There is no income limit on that Fast Forward funding. However, you must qualify as a Virginia resident. In addition to the Fast Forward funding for Virginia residents, there is funding called G3, which is funding based on financial need. The chart on the screen shows the income limitations. For instance, a household of 4 would need to bring in less than $124,000 per year to qualify for G3 financial assistance. Upon accepting the funding, you agree to successfully complete the class and sit for the certification exam. If you don't successfully complete the class, you'll owe the state 1/3 the cost of the class. Because you'll need to pay back the state if you don't successfully complete the class, please take the time to make the right choice for this time in your life. If you have vacations or surgeries or any other significant event that would prevent you from attending class, please wait to register for the next class. Any tuition is due in full at the time of registration. Please note, if circumstances change, you must withdraw from class a minimum of a certain number of days prior to the start of class to receive a refund. Please check the Laurel Ridge Community College Workforce Solutions website for the most current details. Anytime after that, you'll owe the state 1/3 the cost of the class. There is a link on the slide that takes you to the student handbook, which goes over many of the things we talk about in this presentation, plus more.
Welcome to the Dental Assistant program here at Laurel Ridge Community College. It is a certificate of completion program. It consists of didactic and lab, which means you will be in the classroom 50% of the time and in the lab the rest of the time. It is a very hands-on program. You will be helping each other with impressions and taking x-rays, assisting each other with passing instruments. We will start off in the didactic and then move to the lab. Homework consists about 2 to 3 hours a week of homework. It consists of reading at some chapters and then doing the workbook. All the books are provided to you at the beginning of class. It's 160 hours of class, and the duties do include that we cover welcoming patients, setting up instruments and equipment materials. So that means different cements that we might mix in together, or the hand pieces and the hand instruments that we will go over. Sterilization, how to sterilize the equipment, how to break down rooms and set rooms back up for the doctor to come in. We will show you how to do four-handed dentistry with the doctor to help you pass instruments backwards and forwards to them. You will undertake different tasks in the lab, so that again will consist of mixing different materials. We take x-rays on the typodonts, which is Dexter. He is a full skull with teeth, and we can practice on that. We do provide oral hygiene and post-operative instructions to the patients. So we review those and we'll give you some printouts so you can practice on each other giving instructions. Clean and stock room is part of your duty as a dental assistant. So again, we will provide those items for you, but in the lab, you will be assisting each other in filling up the cabinets and restocking the rooms. Assist with patient scheduling, billing, and insurance processing. Again, this will be something that we will cover. We do use the EagleSoft program here at the school, but we also have a Dentrix program that we can go over with you. It does cover different areas of the specialties, so that will cover orthodontics, prosthodontics, oral surgery, endodontics, which is the root canals, and we will go over all of those things with you so you understand what the different specialties are, and maybe that will help you decide if you want to go into a specialty. I hope you've enjoyed this. If you have need any more information, please contact the school.
The Pharmacy Technician Director and Instructor, Ashley Douglas, will go over everything pharmacy tech related.
Hi everyone, my name is Ashley, and like Allison said, I am the Program Director here for the Pharmacy Technician Program at Laurel Ridge. This program is a 400 plus hour program that will leave you able to sit for the National Pharmacy Technician Certification exam. It is estimated that you should spend at least 25 hours a week on coursework. The course is designed with an online didactic program which lasts for 8 weeks. You will then meet one day on campus for a simulation lab, and then you will be assigned an experiential site where you will do 224 hours at a local pharmacy. There are some other expenses to consider, like the costs of any uniforms. You will need to register with the Board of Pharmacy of Virginia. You will have to have a background check and drug screen, as well as immunizations before the first day of class. Pharmacy technicians are in such a high demand currently. Some of the job responsibilities would be to prepare and distribute patient medication under the guidance of a pharmacist, perform calculations, collect payment information like medication history, process billing claims, and assist with prior authorizations. You will also have experience with customer service. Some employment opportunities, you can go the retail route, which is what you're probably most familiar with, like the large chains and local independent pharmacies. You can also choose a career in the hospital setting. And there are also a variety of others, such as long-term care, working for an industry or pharmaceutical company, and even certain specialties. For admission into this program, you will have to be at least 18 years of age, have a high school diploma or GED, regular and reliable access to a computer and internet, and transportation in order to complete your clinicals and to attend the weekly simulation lab. Before you can register, you will need to pass both a math and reading proficiency assessment. If you don't pass on the first attempt, you will have up to 3. Before the first day of class, you must complete and pass a background check, drug screen, and any immunizations that are required by our site. Failure to do so will have you dismissed from the program. Before your clinicals, you must register with the Virginia Board of Pharmacy as a pharmacy technician trainee. Currently, the cost of that license is $25. And sometimes you will have to wear certain clinical attire, such as scrubs or business casual.
The next class we'll talk about is Patient Service Representative. The Patient Service Representative program is perfect for those starting in their career in healthcare because this class includes medical terminology, which sets you up nicely for advancing into the medical assistant program. This is also a great program for those who are interested in healthcare but aren't interested in clinical care. This program prepares students to sit for the Certified Medical Administrative Assistant certification. This class is fully online. You'll meet with your instructor virtually twice a week, and you'll have assignments to do between virtual meetings. You'll learn about scheduling, reception skills, data management, banking, electronic health records, and how to schedule through electronic health records, law and ethics, and insurance information. Patient service representatives are also called medical or unit secretaries, office coordinators, care management assistants, admission specialists, or medical office assistants, plus more. This is a great career to start off in healthcare. So if you're interested, please contact us and we'll give you some more information. Our lead healthcare instructor, Janet Mays, will now go over the medical assistant and phlebotomy programs.
So first I want to talk about medical assisting. How will you know if you would be a good fit for this program? One of the things that you'll need to know is that in order to be successful in healthcare, you really have to want to care for other people. Sometimes you're going to see patients at their worst. They could be scared, hurt, angry, or upset. You're going to need to show compassion and empathy. You'll need to be flexible, and you never know exactly what's going to happen throughout your day. Changes can come as the day progresses. In our classroom, we're going to cover things like professionalism, communication skills. Both of those are vital in the healthcare industry because we will be working with patients. We cover medical terminology, anatomy, and physiology. We use those skills then as we begin to learn how to care for our patients through direct patient skills. You'll also learn things like EKGs and phlebotomy as a part of this program. Our program consists of 160 hours of in-person and or sometimes Zoom classrooms. You'll be performing didactic through your homework textbook as well as clinical simulation skills in our classroom. You do need to have regular computer access and reliable internet. Some places that you might be employed as a medical assistant: urgent care centers, different types of specialty clinics like cardiology, OBGYN, or neurology, just to mention a few. Medical assistants often have routine daylight hours. The exception of that, of course, would be urgent care facilities. However, many urgent cares offer the flexibility of 12-hour days so that you work less days during the week. Medical assistants are in high demand. It is expected that we are going to be needed more and more as things continue. Some of the clinical and administrative duties that we'll be covering are vital signs, setting up and assisting the physician with procedures, administering injections, and performing point of care testing. Again, we mentioned phlebotomy and EKG. But as a certified clinical medical assistant, you will also do clerical duties. So you will learn how to work both the clerical or the front end of the office and the clinical or back end of the office. As you think about what you would like to do, please know that medical assistants are very versatile in the allied health training field. So phlebotomy. How do you know if you would be a good fit for this type of program? To be a good candidate for phlebotomy program, you obviously do not want to be squeamish. If you're in this field, you're going to be working with blood and other body fluids all day, every day. It helps if you have a naturally calming nature because it makes the patients more comfortable, as they oftentimes do not enjoy having the phlebotomy procedure performed. Another important factor for phlebotomy is that you have to have attention to detail. You need to be able to work under pressure. It's very important that you collect the right tube for the test that was ordered and in the right order of collection, making sure that you give the physician accurate test results. Our program here in the class is a 55-hour program that combines textbook learning, lecture skills, and your clinical procedures. During this procedure, we do use practice arms initially, but they're usually used to teach you needle safety. You will be doing your blood collection and learning the art of phlebotomy through testing on one another. It is required that you perform and receive a minimum of 30 venipunctures as well as 10 capillary punctures. This is essential to the job of phlebotomy. We also do non-blood collection testing, things like wound cultures, strep throat test, influenza swabs, and some other types of testing. Phlebotomists are in a very high demand as well. Part of what we do when we're learning about drawing the blood is the order of draw, which order you need to collect the tubes in. It doesn't seem like it when you just look at them, but the order of draw is vital to the outcome and accuracy of test results. You can be employed in doctor's offices, specialty clinics, urgent care clinics, and even in the lab. Also, phlebotomists are hired in the hospital. If you like early morning hours, labs in the hospital often start as early as 4 a.m. So those may be hours that would work with your schedule.
There are some other classes that could be of interest to you. We have Spanish for Medical Professionals, which is an online class, CPR or Basic Life Support, and if you already work in the dental field, you can take our Dental Health and Radiation course. The snapshot on this slide shows current job openings in the Laurel Ridge Community College service area for medical assistants, dental assistants, phlebotomists, pharmacy techs, and medical administrative assistants. All professions are highly needed in this area, with median ranges falling between 42 and 45,000 a year. Laurel Ridge Community College offers other support services. The Office of Accommodations and Disability can help set you up for success in the classroom. If you have this need, contact the office directly to get accommodations set up prior to the first day of class. There's also something called Single Stop, which helps students connect with community resources that can assist with food resources, transportation, housing issues, etc. There are a lot of information on our healthcare need to know pages. The link is there in this slide. And we also have adult education that can help with study and organization skills and assist English language learners with connections to improve language skills needed to be successful in class. If transportation is a concern, there are public bus systems that can get you to campus from 50 cents to $2 each way, depending on the transport that you use. Check out the schedules on the public transit site in Winchester and the Corridor Connector or Circuit Rider in Fauquier County. There's links on the slide to those as well. All the classes we went over in this presentation, plus more in technology and trades, are located in our course catalog, which can be found on the Laurel Ridge Community College Workforce Solutions website. There's also a link to our current catalog on the slide there. Please contact Workforce Solutions with any questions. We are open Monday through Thursday from 8 to 5 and Fridays from 8 to 4. The phone and email address is on the slide. We hope this information helped you as you decide on a career in healthcare. Thanks so much for coming.